Hello everyone, welcome to today's presentation on the basics of sex therapy models. I am your host, Cecilia Dunn. Today I will be talking about the basics of sex therapy models, but firstly describing what sex therapy is and how it began. I will then discuss the psychobiosocial approach, the sensate focused therapy model, mindfulness, and the Plicit model. I will provide a model to describe how it can be used to treat someone with sexual difficulties, followed by a summary and my references used. Sex therapy was first termed in 1958 by William Masters. However, later during the 1960s, many of the psychophysiological studies from William Masters and psychologist Virginia Johnson helped them to develop a therapeutic style that treated sexual problems and inadequacies. Masters and Johnson had preferred working with couples who could discuss their sexual difficulties together. Today, there are numerous approaches for treating sexual problems, which include aspects from behavioral therapy, rational emotive therapy, emotion-based therapy, physiological approaches, mindfulness-based interventions, communication-based, as well as cognitive behavioral-based approaches. Sex therapy is multidisciplinary because of other medical specializations and practitioners who intervene in caring for the individual and couple's health. Sex therapy is used for an array of conditions having to do with sex and intimacy. Therapy helps to dispel the myths and helps couples and individuals to understand what sex should be like, because sexual desire is not an automatic response, but is elicited. Sex therapy helps couples to talk about issues with their partners and learning how they could communicate more effectively with one another, improving one's sexual health, and learning to have a more satisfying sex life. Sex issues can affect a relationship if the couple who is seeking care is unable to find treatment for feelings of inadequacy and distress that one or both may be experiencing. For many couples, they may have already consulted a psychotherapist and a medical professional, which has not offered a complete solution to their issue. A sex therapist can help clients to have a more comprehensive approach, whether they use a psychobiosocial approach, a sensate focused therapy, whether they use mindfulness, or they use the Plicit model. In every approach, medical interventions and referrals may be needed to treat the whole person in order to improve one's sexual functionality, their image, and even their identity. The psychobiosocial or biopsychosocial approach looks at how biological, psychological, and social aspects of sexual issues are connected, and not just from a medical perspective. This model attempts to integrate these approaches, looking at couples' functionality and sexual style. The biopsychosocial model has been seen as more of a medical model, which treats mainly individuals with conditions such as diabetes and disease, as well as social factors. They may use medications as first-line treatment over psychological interventions. However, in the psychobiosocial approach, therapists and doctors value the importance of relationships, and they look at sexual issues as multi-causal. They're not just seen as physical problems, but they look at the attitudes that people have, feelings, and situations they are in, because they encompass sex and issues with the body's responses as well. In the psychobio approach, they hold on to the idea that not all sexual encounters are great, and this is known as the good enough sex model. Interventions include psychological, medical, and relational interventions, and individuals alone are not to blame but are responsible for seeking treatment, assessment, and learning what they can do to prevent future relapses. In the psychobiosocial approach, they do not embrace traditional male performance roles, and they manage having a perfect erection for every sexual encounter, but teaches that some sexual encounters will be just okay. Couples may be encouraged to enjoy their sexual encounters and work to maintain good health and mental health as well. The sensate focus approach, this approach that was developed by Virginia Masters Johnson and William Johnson in the 1960s, evolved into a therapeutic style that has now developed specific exercises of touching. Sensate focus was created to help treat sexual complications and treat performance anxiety that interferes with sexual functionality. Sensate focus involves a couple making themselves comfortable in their environment. They may remove most of their clothing and strive to connect with their partner through physical touch. Each partner is either touching or allowing their partner to touch them. It is a time to focus on sensuality through tactile sensations, and the partner being touched focuses on temperature and pressure, as well as allowing the body to respond naturally. Responding naturally means allowing emotions and feelings to arise, as well as arousal and orgasm, if it is naturally occurs at this time. The first phase of sensate focus is not used to create voluntary responses such as genital stimulation. In the first phase, the partner touching does not focus on their partner's arousal. In this beginning stage, the couple is encouraged to write down what they are feeling and experiencing, but they are not to share it with each other just yet. At this time, as time goes on, sensate focuses on other areas of the body which were off limits, and they become permissible to touch. There are 5 stages, which include sensuality versus sexuality, which includes genital and breast touching. Stage 4 is adding lotion and mutual touching, and the last stage involves intercourse that is sensual. The duration of this form of therapy is usually about 8 weeks. Mindfulness as sex therapy. Mindfulness meditation in itself has been around for thousands of years, practiced by religions such as Buddhism. Dr. Laurie Brodo, a psychologist, has done a study in 2002 and 2003 on how mindfulness could help conditions such as anxiety and help people who were in chronic pain that did not respond to medical treatments. Dr. Laurie Brodo felt that mindfulness could be a vehicle to connecting mainly women to their bodies. In the mindfulness approach, it's about teaching skills to clients on how to remain in the present moment and becoming non-judgmental of what is occurring during sexual arousal. It's about learning how to slow thoughts and about remaining aware and open to discussing sexual problems using effective communication and problem-solving techniques in order to attain an overall relational well-being and relational health. In mindfulness for sexuality, there are 2 types of mindfulness which are examined, known as trait and state mindfulness. In trait mindfulness, which occurs mainly for women, they are to examine what is happening in their bodies, such as when they are experiencing lack of desire, arousal, or even feelings of physical pain and anxiety in the body. In state mindfulness, the client is focusing more on the sexual encounter and its heightened emotional and stressful state. In mindfulness, clients are encouraged to pay attention to sensations which are occurring in their bodies. Exercises used are meditation, and later therapy will require clients to do exercises at home, such as arousing their bodies using vibrators and touch to induce arousal, gazing into their partner's eyes, or even touching partners and noticing sensations, as well as looking to the future and not the past, where trauma may have occurred. A sex therapist would have a client attend therapeutic meditations 3 days a week for 5 to 7 hours per week. Exercises include genital acceptance, masturbation coaching, orgasmic meditation. Erotic mindfulness has been shown to be effective through anecdotal evidence of helping clients to move beyond the pain of trauma and heal from sexual issues. The Plicit Model. What is the Plicit Model? This model was developed by Jack Annan in the 1970s. The Plicit stands for Permission, Limited Information, Specific Suggestions, and Intensive Therapy. What this created was boundaries and clear objectives with the 4 stages, which includes permission seeking. Practitioners would ask clients for permission before asking them to undress for an examination. Another example would be to ask a client if they would like to read information about a procedure before simply handing the client the reading material. Practitioners also make sure the client or clients know that they are open to answering any questions, as well as following up with clients to examine the interventions that are being used. In limited information, having knowledge of the condition or treatment may be all the client needs, but that may change in time and require the physician to make a referral to a competent therapist or specialist, such as a gynecologist, who would treat a patient who is reporting physical pain, such as in treatment, pain during sex or after sex, as well as treatment for women with vaginal changes during menopause. For a man, they may struggle with physical issues such as erectile dysfunction. Sex therapy would be needed if the client still has no desire to have intercourse, feels anxious, or has tremendous guilt. Specific suggestions means it comes from service users themselves, and therapists may suggest using different modalities of therapy that would encourage the client to find their own solutions. It is after offering a solution that they may offer detailed information about the issue and specific techniques to change certain processes. Intensive therapy includes seeing a therapist trained in relationship therapy and knowledgeable about sexual issues. This model can help relationship issues by targeting the problem occurring for the client and referring to specialists when it is necessary. So what is a model that can address sex therapy? All the sex therapy approaches mentioned could help clients who are struggling with sexual dysfunctions. However, I felt that the Plicit model was one of the most comprehensive approaches for treating an array of sexual dysfunctions, as well as treating other co-occurring conditions that the client has been diagnosed with or may need a diagnosis for, such as an adult in their late middle ages who has developed type 2 diabetes or menopause. In the permission seeking step, the doctor would ask the client information on diabetes and how it has affected their sexual functioning, and then ask the client in person a Q question, such as a way to help them open up about how their diabetes has affected their sexual health. This is also an area that would require the patient to give permission. In the second step, limited information, the care provider would inform the patient about how someone's sexual functioning can be affected by diabetes. If the patient has opened up and admitted to having specific symptoms, a referral may be needed for the patient to see a urologist or gynecologist. If the patient reports feeling guilt about not being able to have sex and being unable to attain an orgasm, that is where the care provider would continue on asking the client to complete certain assessments. Step 3, providing specific suggestions, means that after determining the problem, the care provider would want to gain a sexual history of the patient and or couple that is presented, as it may reveal that the patient has no sexual desire or little sexual arousal since they experienced a trauma in their life. In step 4, the client would then be referred to either a psychologist or sexologist for further treatment. This model in itself does not provide a solution to sexual problems, but serves as a tool and a door to other care providers who can assist the patient by normalizing the treatment for sexual issues as well as addressing other medical issues. That individuals and couples could benefit from. Each approach has different techniques and methods. In sex therapy, the therapist will work to assess their clients and treat them in the most effective manner. In this field, it's still in its infancy in understanding sexual issues that occur primarily in women and for men. In every approach listed in this presentation, medical interventions and referrals to other specialists may still need to be made in order to care for the patient. Thank you for watching this presentation, and this concludes the presentation on the basics of sex therapy model. Here's a listing of my references used.